Nice.
Hey Final Frontier Warriors, it's Matt again, Final Frontier's ALPS tutor and LSP tutor, just giving you guys some information about burns. Thought I'd throw a little SpongeBob reference in there for you. So we got some information here for you, gonna go over different levels of burns. So first off, we've got epidermal burns, typically kind of looking at more like the sunburn levels or even just like a light burn from, you know, some radiation or something like that. Epidermal layer is going to pretty much be damaged, and we're going to see no blisters, just delayed pain, maybe like the uncomfortable pain to touch, some of that allodynia, which is pain to a non-painful stimuli typically. No scarring, no edema present with that situation. Then we go to the next layer down, we're getting the superficial partial thickness. Now we've burned off a couple layers of skin and we're into the layers of the dermis. We've gotten into the bright pink or red levels, kind of a mottled red appearance. Kind of looks like there's an inflammation present. A little deeper, you might actually see separations of the skin present at that point in time. Erythematous usually comes up, there's a blanching level, and there's usually a brisk capillary refill. These superficial partial thickness burns tend to hurt a lot more. They're more painful because we're into the depths of the skin, but not all the areas of the pain and not even pain, but just those tissues that can still feel pain. They're not all gone. There's still levels of skin that are still there. Moderate edema is usually present at this point, and you're going to have spontaneous levels of healing. Minimal scarring is usually present, and usually heal within like a 1 or 2 week time frame. Sometimes a little bit more, a little bit less, depending upon how much of those levels are there. Next level down is going to be the deep partial thickness wounds. We're looking at mixed red, waxy, white type appearance. Usually looks like a large layer of skin has been chunked off. This one's a little bit less painful. Not going to have as much of the weeping and blistery presentation as the superficial partial thickness, but more of like kind of like this general broken blister, like almost like sort of kind of pseudo leathery, but not quite there. Very insensate. They usually don't have a whole lot of pain. Soft pinprick is usually present. Soft pinprick and light touch are usually insensitive for that patient population. And a lot of times you're going to see a pretty large amount of edema, slow healing, and a lot of excessive scarring is going to come in with the deep partial thickness wounds. Your full thickness wounds get into that level where the whole layer is completely chunked off. There is no more dermis left, and the person is now into the depths of basically subcutaneous being potentially exposed. This is the white, charred, tan, fawny, mahogany, black, reddish black coloring. There's thrombosed veins. Usually the vessels are usually kind of little splotches and blots of the dark presentations that are specifically interspersed throughout the skin, and usually a parchment-like presentation is present, and they're not going to have a whole lot of mobility within the skin. Usually very depressed in that area. Healing is usually going to require grafting or scarring, and it's very, very high level time period for healing. It's going to require a lot of compression garments, a lot of soft tissue work, a lot of very controlled management from a burn specialist, either NPTE or even just a burn team. It's a very interdisciplinary management type problem. And then the final level is going to be your subdermal burns. We hope to never have to see populations like this. It is very hard for patients to come back effectively from this. Usually the skin is just completely charred, insensate. Usually muscle damage is affected. You're usually going to get neurologic involvement. A lot of times you're going to have a lot of the tissue defects come in. Skin is going to require a graft or even a muscle flap for healing. This one's going to require many months, if not years, for healing. Well, like again, deep partial thickness, full thickness, those are a little bit less time frame for your healing times. But again, love the SpongeBob reference. I hope you guys are SpongeBob fans. For those of you that know SpongeBob well, hopefully you guys got a good laugh out of it and you guys enjoyed the video about burns. Tune in next time for me. We'll cover some more content, hopefully related to the NTAG stuff a little bit, since it's a nice category to cover. And it's a lot of times a struggled area for students. So I hope you guys are doing well, and I hope to see you guys again soon.